Good morning, everyone. It is my pleasure to welcome you to the 15th Annual Holistic Health Seminar on Memory Loss, organized by the Memory and Aging Community Advisory Board, which is also known as the MACAB. My name is Ernestine Jones Jolivet. I am the chair of the seminar's planning committee and the MACAB's board development chair. Thank you for joining us. We have a fantastic morning planned for you. Before we dive into our agenda, I would like to invite Pastor Rodney Morton, Senior Pastor at Central Baptist Church in Baltimore City, to lead us in our opening prayer.
Thank you, Madam Chair. May we center ourselves for this moment of prayer. Loving God, in whose presence our soul takes delight, God of our mounting moments and even our valley hours, we come before you on this day, seeking your wisdom, knowledge, and understanding. As we share in this time of a community of shared wisdom, we invoke your blessings upon every presenter and every participant. We ask now, God, your special healing upon those who are suffering from memory loss, for those caregivers, and even for family and friends who join in a community of support around each of them. God, I pray for the vision, the leadership of MACAB, but moreover, God, for the people and communities that we serve. May our hands and hearts be strengthened and united for the cause for which you have called us to. May we never lose sight of the service that we offer to our community, and may we continue to pour water in desert places and continue to transform our communities into an oasis of hope from a desert of despair. We look to you even today, that as each presenter shares, that it will be like water poured into a desert that will give hope, healing, and offer greater opportunities. And God, may we never lose sight of the fact that we're called to care for one another. And may we live out the creed and code of being our brother's keepers. In the name of him who walked with the poor, who dined with sinners, who died a suffering Savior, but was raised victorious. In his name we do pray. Amen.
Amen. Pastor Morton, thank you for that warm opening prayer. It was just what we needed to start our morning off. Thank you so much. Well, let's get started with our program. For those of you joining by Zoom, you can see today's agenda on the screen. As we'll hear this morning, there are many ways to care for ourselves as we age. Although often underestimated, the need for self-care is particularly important for those of us who are in caregiver roles. The seminar's theme is self-care for healthy aging, mind, body, and spirit. Today's event will feature presentations by individuals with expertise in health services, brain health, grief and loss, and spiritual well-being. We will also learn how to manage our stress levels with an interactive yoga and meditation demonstration. At the end of the event, you will have an optional 45-minute session on healthy living for your brain and body, led by the Greater Maryland chapter of the Alzheimer's Association. That session will begin at 11 a.m. and we hope that you will decide to stick around. I want to take a moment to highlight this year is our 15th annual seminar. This is quite an amazing accomplishment, if you ask me. With this milestone in mind, I would like to provide a little background. Years ago, the term sandwich generation was coined. This referred to individuals in their 20s to 40s who were raising their own families and also caring for older family members, such as parents or grandparents, around the same time. Administrators and clinicians at Johns Hopkins began to collaborate with individuals and the community groups to discuss ways to better meet the needs of caregivers. To accomplish this lofty goal, individuals from Johns Hopkins and their community partners attended health fairs, spiritual outreach seminars, and workshops. From these efforts, the Memory and Aging Community Advisory Board was formed in 2004 in recognition of the need for providing ongoing and updated resources and assistance to caregivers and their loved ones. Notably, in 2007, the McCAB held its first annual Holistic Health Seminar. Through this forum, the McCAB has been able to share up-to-date caregiver resources and health information with the greater Baltimore community. To this day, the McCAB is still focused on caregiving, not only caring for others, but self-care as well. We hope that you learned today, what you learned today will enrich your care for yourself and for your loved ones. Despite the fact that in 2022, Alzheimer's disease and other types of dementia continue to disproportionately affect African Americans. While the reasons for these disparities are not well understood, it's important to know that there are several things that we can do to reduce our risk of diseases that cause memory loss. The idea of dementia risk reduction was most recently recognized by the new goal in the National Plan to Address Alzheimer's Disease. The new goal focuses on promoting healthy aging and dementia risk reduction by reducing the prevalence of dementia risk factors such as diabetes, depression, high blood pressure in midlife, physical inactivity, poor diet, obesity, and more. With no treatments for dementia readily available, addressing these risk factors will play an important role in protecting the health of our brains now and as we get older. Health is not just the absence of sickness and disease. According to the World Health Organization, health is a state of complete physical, mental, and social well-being. This definition embodies the holistic approach to wellness that we try to emphasize every year at this seminar. Before we hear from today's wonderful speakers, I'd like to briefly review some Zoom features. First, we want to let you know that your microphones and cameras will remain off throughout the duration of the event. Today's event will be recorded. After the event, the recording will be posted to the McCAB's website at www.baltimoremccab.org. We will distribute this link by email once the recording is available. Second, if you would like to ask a question, please click on the Q&A button on the bottom of your screen. You can ask a question at any time by typing your question into the box. Our event moderators will read the questions to our speakers on your behalf during the Q&A portion of the event. Third, throughout the event, we will use the chat box to send messages to attendees and share links to helpful resources. Lastly, we will be inviting you to complete a post-event survey. This will help us gauge the success of our event and how we can improve in the future. To show our gratitude, the first 200 individuals to complete the survey will receive a free reusable tote bag by mail and will be entered into a raffle drawing for 4 $50 Instacart gift cards. The link to the survey will be put in the chat box at the end of today's event. Rest assured, the link will also be sent to you by email after the event. The survey will only take you a few minutes to complete, and we thank you in advance for your feedback. With our Zoom housekeeping now complete, I would like to take a moment to give a big thank you to our event sponsors. This includes the Memory and Aging Community Advisory Board, the Johns Hopkins Alzheimer's Disease Research Center, the Greater Maryland chapter of the Alzheimer's Association, the Baltimore City Department Division of Aging and Care Services, the Baltimore County Department of Aging, Time Printers, Print Ink Online, and Epworth United Methodist Chapel. We appreciate their support of today's event. It takes a village to have a seminar like this. Now that you've met our event sponsors, we would like to get to know you, our audience. For those of you joining us by video conference, you have 3 poll questions that will appear on the screen at the same time. Our apologies to those joining by phone. You will not be able to complete these poll questions. These questions will ask how many times you've attended the Holistic Health Seminar in the past, your age, and your race and ethnicity. We'll give you about 60 seconds to reply to these questions by clicking on the response that best applies to you. They're coming up, it's on the screen now. You may start answering the questions. Okay, do we have the results? Excellent. Well, we have 62% first-time attendees, 14% second-time attendees, and 6% third, and 18% 4 or more times. And we have age range of, I think we have 35% that are between the ages of 60 and 69. Excellent. And as far as ethnicity and race, 63% African American or Black, and 29% Caucasian, and 4% Asian Pacific Islanders. Well, we're so happy to have you join us today and take part in our survey. The response has been amazing. Thank you. Let's turn to the first speaker on our agenda. It is my pleasure to introduce Lisa Hunt. Over the past 40 years, Lisa Hunt has worked as a nurse through a variety of hospitals and outpatient care centers. She is married to Reverend Dr. C. Anthony Hunt and is the First Lady of Epworth United Methodist Chapel in Baltimore, Maryland. Mrs. Hunt is a dedicated member of Epworth's Health and Wellness Ministry. Throughout this pandemic, Epworth has kept its congregation informed weekly about COVID-19. This morning, Mrs. Hunt will be providing us with an update on COVID-19. Mrs. Hunt.
Good morning. Over the past 2.5 years, we have all been inundated with so much information about COVID-19, and although it is still very much a reality, we do know more about it and have developed tools to help in the fight to protect and keep us healthy. But we are also still learning about the virus, the variants, and long-term effects. Several weeks ago, our country faced a sobering moment when the number of COVID-19 related deaths in the United States reached 1 million. Globally, the number of deaths is estimated at 15 million. Our Maryland positivity rate is now at 8.14%, but this number is likely higher due to the number of people who test positive at home, but do not report their results. So there is focus not only on the positivity rate, but on other indicators to track the numbers, to include the number of hospital admissions, deaths, and overall vaccination rates, which all continue to be monitored closely when assessing the community impact of COVID-19. Over the past month, the key metrics in our state continue to increase slowly and move in the wrong direction. Earlier this week, 509 people in Maryland were hospitalized related to COVID-19, and 9 more people have died from it over the past 24 hours. Recently, it has been a bit confusing with mask mandates that are in place one day and not the next. The CDC continues to recommend masks on airlines and all public transportation, as the active Omicron BA2 subvariants are more transmissible than prior variants. In preparation for the possible surges this summer and fall, the government announced that households may order up to 8 more free home antigen testing kits via the website covid.gov/tests. It's important that each of us make personal decisions and keep in mind what works best for you, your family, and community. If you are going to be in contact with elderly family or friends or people who are immunocompromised, it is best to protect yourself and them. Anyone may choose to wear a mask in any situation they consider potentially risky. Select the highest quality mask that is affordable and may be worn comfortably over both the nose and mouth. Properly fitting N95 masks provide the best protection. We must continue to create work, church, home, and social environments in which all who choose to mask feel welcomed and included. Vaccines are an effective and critical tool to bring the pandemic under control by helping to prevent infection, serious illness, hospitalizations, and death due to COVID-19. Although there are cases of people who become sick after they are fully vaccinated and boosted, cases where fully vaccinated people are hospitalized and die are rare, and vaccines remain the best way to prevent COVID and its complications. As with vaccines for other diseases, you are best protected when you stay up to date. Getting a COVID vaccination is a safer and more dependable way to build immunity to COVID than getting sick with it. So if you've already had COVID-19 and have recovered, it is recommended that you get the vaccine, which will provide added protection against the disease. So a reminder to the difference between being fully vaccinated versus up to date. You are considered fully vaccinated 2 weeks after your second dose in a 2-dose series, such as Pfizer or Moderna vaccines, or 2 weeks after the single-dose J&J vaccine. Fully vaccinated, however, is not the same thing as having the best protection. People are best protected when they stay up to date with COVID-19 vaccinations, which includes getting boosters when eligible. A second booster, which would be a 4th shot for many of us, of Pfizer or Moderna, is now available for adults 50 years and older and should be given at least 4 months after your first booster.
1
Pediatric
minute,
cases
Mrs. Hunt.
are up 76% across the country in the past weeks. The good news is that there is now another level of protection against COVID-19 virus for children. The FDA has approved and the CDC recommends a booster shot of the Pfizer vaccine for children ages 5 through 11. They are eligible to get this booster at least 5 months after their second dose. Pfizer trials for children 6 months to 5 years are showing promising results with a vaccine that appears to be safe and show a strong immune response in this age group. Both Pfizer and Moderna are submitting their trial data to the FDA for possible approval in the very near future, and vaccines may be available for this age group possibly as early as June 21st.
Mrs. Hunt, 1 minute.
If you are still needing to update your vaccination status, visit vaccines.gov to find vaccination providers near you, or text your zip code to 438829 or call 1-800-232-0233 to find vaccination locations in your area. COVID-19 vaccines are available for everyone ages 5 years and older at no cost to all people living in the U.S., regardless of health insurance or immigration status. Thank you and stay safe and up to date.
Thank you so much, Lisa, for that very important update. This pandemic continues to affect all of us in a variety of ways, and we must ensure that we're doing everything possible to keep ourselves and others safe. Thank you again for this important information. Next is our speaker panel on self-care for holistic wellness. Today's panel will include 3 presentations. Each presentation will be about 12 minutes each, and these presentations will be followed by a Q&A session at the end of the panel. As a reminder, please type your questions in the Q&A at any time. Our first speaker is Dr. David Johnson, who is an associate professor of neurology at the University of California, Davis. Dr. Johnson is a licensed clinical psychologist with expertise in late life mental health issues, including dementia and vascular contributions to brain health. Dr. Johnson also directs the California Dementia and Diabetes Prevention Program, known as The Good Life, and has extensive experience working with members of the community. Today, Dr. Johnson will share his expertise on nutrition and brain health. Please join me in welcoming Dr. Johnson.
Thank you, Ms. Jolie. That was a wonderful introduction, and I've been enjoying this morning quite a bit. So thank you all for having me. It's a real honor. I was saying to some of the folks earlier today that I'm from the district, and it's nice to be back home in a way, although I'm so far away at the moment. But I'm here and to talk about nutrition and how we can keep ourselves healthier and happier. I think this is really an under-stressed point for many of the folks out there like myself who are stressing healthier lifestyles. Healthier lifestyles isn't just about keeping your heart and your brain healthy, but it's also keeping your soul happier and to keep you engaged with your family and to keep you living well longer and being that example for your children and your children's children. Can I have my first slide, please? Is that being seen? Here we are. So I was asked to talk about something that I'm quite passionate about, nutrition and brain health. And how can nutrition have an effect on your brain? That always is, of course it does, but how that happens is a great mystery in life. Can I have the next slide? So one of the things that we've known in science now for, I don't know, 50, 60 years at least, and this comes from mostly like lab work and stuff, so what's it got to do with people? If you don't eat as much, you live longer. It's a weird and strange fact, and it's kind of counterintuitive because within our culture, of course, eating is such a robust social event and eat, finish your glass of milk. You won't grow if you don't, is sort of a thing I find saying to my kids all the time. You've got to eat to grow and be healthy. If you don't eat, you're not going to be healthy. All that's very true, especially for children. But as we get into our adulthood years, we know that eating less is actually the healthier alternative. It doesn't mean to starve yourself, but it means to reduce your caloric intake and focus on the healthier foods. So we want to reduce the number of what I call empty calories, right? All of us have done that. Well, I'm just going to have a piece of toast, or I'm going to have this little chip, or I'm going to have this nice delicious donut or something like that. Those are empty calories. All they are is sugar, and we all know what damage blood sugar, what sugar does in our communities. And diabetes is, of course, one of the leading killers for Black Americans. And we need to replace our empty calories with calories that are feed us. So here we have an orange on the screen. Breakfast with oatmeal reduces our cholesterol. There are many ways of just making simple changes in our diet that's going to really make a difference. And I think once you start to try to replace some of those empty foods with better food, you'll find big differences. Next slide, please. So we move along, and the 1930s and 40s, when this was first being discovered, that's a long time ago, and we have a lot more science when we've actually looked at these issues in a very methodical and rational and thoughtful way. And one of the first things that we really learned is that this thing that we call the Mediterranean diet, some of you might have heard of that, is a whole lot healthier. And really what it is just replacing those empty calories with better things. And this is a diet that emphasizes vegetables. What a surprise that vegetables are healthier for you. We're trying to eat less fat that is animal based. And in this diet, you're using olive oil more, you're eating fish, and you're eating as if you live on the Mediterranean, right? Who wouldn't be happier if you lived on the damn Mediterranean? It's a nice place. You want to eat as if you're living on the seashore, more fish, more poultry, olive oil, vegetables, these are healthy for you. And it really reduces your risk for heart disease and stroke. It's really an amazing difference that it can make in your heart health, your brain health, and your well-being. Can I have the next slide, please? So now we move on a little bit, and we got something called the DASH diet. What I wanted to do is make sure that everybody gets a smattering of all these different types of diets. It's like a new dance fad or something. This DASH diet is it's got a goofy name, the Dietary Approaches to Stop Hypertension, right? So what I want to talk about here is it's awful lot like the Mediterranean diet, but it's really also focusing on reducing our salt. So there's something called salt loading that restaurants do in particular. That's why restaurant food tastes so darn good. And the food that you like to eat that tastes good, that is frozen foods, that are prepared foods, these people know that they want to make this stuff taste as good as possible so that you eat as much and you feel great. Applebee's, right? Applebee's salt loads. They just dump the sodium in, they dump the salt in. And you got to be thoughtful about how much salt you take, because that salt is actually bad for your heart in the long run. So again, you're not eating empty calories, you're replacing those with good calories like fish, like vegetables and fruits, but now you're also adding the reduction in salt. So when you have those vegetables, whatever you're eating that you like, whether that's broccoli, Brussels sprouts, kale, beans, whatever, don't dump the salt in there, and don't dump the fat. You're trying to not make it so it doesn't taste like anything, but you don't want it to be so high in sodium that you kind of feel bloated or swollen almost after you eat your dinner. Next slide, please. Now there's this new one called the Mind Diet. And guess what? They've combined cleverly, scientists really aren't that clever all the time, the Mediterranean and the DASH diet, and they call it the Mind Diet. And it's emphasizing leafy greens, not just any of the vegetables, but berries, nuts. It's kind of taken that, I don't know if any of you heard or know about the Paleo Diet, right? We're supposed to eat as if we're cavemen or something. No, it's just, you're going to eat leafy vegetables, berries, nuts, and beans, only good oils, that olive oil instead of that corn oil and fat, light white meat like chicken and fish, and you're just trying to cut down fat, salt, and empty calories, really. So next slide, please. So all this is no good unless you can have some way of remembering all this. And the way that I like to talk about this and to tell people is, I want you to eat closer to the sun. I want you to eat more colors of the rainbow on your plate. In other words, you want to eat something that's actually been grown or has lived and has actually seen sunlight, as opposed to that frozen bag of some prepared food that's either in your freezer or something like that. So you want to eat much more vegetables, and you want to eat different colors. The more colors, the better. Red, green, yellow, purple. Put these things on your plate. They look beautiful. They taste great, especially if they're if you get them fresh. And you just want to make this part of your life. It's a philosophy about treating yourself healthy. Your body is your kingdom. Your body is important. And how can we treat ourselves well? Well, by eating something that's going to help us grow and thrive and be happier, rather than to feel bloated, feel heavy, feel and hurt our hearts or hurt our brains. And whatever's heart healthy is brain healthy, period. Those two are tied, interconnected so much that you when you see something that says heart healthy or brain healthy, you know it's good for both of them. Next slide, please. So what about processed food? There's been a lot of talk about, bacon and smoked foods, preserved foods, trans fats, margarine, these kinds of things. These preservatives, which is effectively what smoking does, is it preserves the meat, it preserves the vegetable. We have come to learn that process of the preservatives, which is also smoking the meat, is really very bad for our inflammation. So when you cut yourself and you get inflamed, the same thing is happening at a cellular level inside of your body. And these trans fats are like little bullets that are, or you could almost think of them, sometimes I talk about them like shards of glass, almost as the size of the, they're going around cutting up stuff inside of you. And you need to have constantly be healing. And these smoked foods, these processed foods, have inflammatory processes that are constantly going on. And we know that this is just killing us. And that these nanoparticles, if you will, these small trans fats like the margarines, are very, very, I don't want to quite call them poisonous, but they are very bad for us. Next slide, please. And one of the things that I like to bring up as a aging and memory person is that we want to mimic the long-lived, and they have wisdom that we want to learn from. And the main thing that we need to know is that if you live to be 90 or 100, the thing that makes these people very different than the rest of us is that in their genes, they have these genes, many more genes. We all have some of these, but they seem to have a very high concentration of genes that are anti-inflammatory. So they're taking care of all of the toxins that they may be eating throughout their lifespan. And their genes are giving them an extra boost to stay healthy. Well, we can do the same thing just as regular people without those special genes. If we think about the inflammation and the types of food that we eat, we can limit that. We can also live long. Next slide. So here is
Dr.
some of the
Johnson, 1 minute.
great. I'm at my last slide, I think. So these are some of the most anti-inflammatory foods, and you'll see that they're set. I've been talking about these over and over again throughout the whole entire presentation, that these are the foods that make up the Mediterranean diet and all of the variants of it, right? Olive oil, we got nice fish, good natural fatty fish, and avocados, broccoli, berries, green tea is a new one on here. But the idea is to reduce the inflammation from the food that we're eating, because believe it or not, that donut, that bacon, that overly salty gumbo that we might be eating, those foods are hurting us. And there are other foods that can help us live longer and better. And so it's up to each of us to treat ourselves healthier and try to be happier and live an exemplary life and eat more anti-inflammatory types of foods, reduce our calories, our caloric intake, and watch what we eat, and we'll be heart healthier, brain healthier, and a whole lot happier. Next slide. I think we're done. There's this is the piece of the science that I just wanted to say. There are a lot of very, very thoughtful, well-educated people that are looking at the chemistry of this, and we're starting to understand it more and more. And I think we're going to have a fantastic next 5 or 10 years for food science, and we're going to learn even more. So with that, I thank you all. I think there's some references. Just click on through. I think these slides are made available to you, so these are things if you want to read afterwards. And I appreciate your time and your thoughtful attention.
Thank you, Dr. Johnson. That was an excellent presentation and so helpful and so meaningful for those people who do have problems with inflammation in particular. Excellent.
It's my pleasure to be here. Thank you for having me.
Thank you. Our next speaker is Reverend Deborah Hickman. Reverend Hickman is the co-founder and CEO of Sisters Together in Reaching, Inc., whose mission is to advocate for spiritual and physical wellness, facilitate the delivery of high-quality patient care, and provide education on the treatment and prevention of chronic diseases among minority communities. Reverend Hickman has also worked with federally recognized healthcare centers to bring health workers to the community to booster the quality of health care, reduce care costs, and improve population health. In addition, Reverend Hickman serves as the community co-chair of the Community University Collaborating Committee of the Johns Hopkins Urban Health Institute Center for Cardiovascular Health Disparities. Reverend Hickman will discuss the importance of incorporating spiritual care in our daily lives. Before we begin, we invite our audience to respond to another quick poll question, which will appear on the screen now. Thank you so much for responding to the poll. Now let's look at our results. Some of the practices that people that have responded indicate that 75% use prayer and meditation. 71% physical activity, nutrition. You know, we have a pretty good audience. All of the things that we need to do for restorative practices seem to be incorporating it. And those who did not respond, you have to find out from Dr. Hickman what you can do. Thank you for responding, Reverend Hickman. The Zoom stage is yours.
Thank you very, very much, Mrs. Jolivet, and the great job that you have been doing. Good morning, everyone. Thank you very much for having me. I'm going to speak to the topic of spiritual care for yourself as well as others. And my PowerPoint is entitled Unselfish Living, because I feel like in these days and times, we have to live for each other as well as self. And if we are walking around saying that we love the Lord, then we cannot hate anyone, no matter what our race and our cultures are. We're here to help and do what it is that we have been created to do and to find that out. And so I want to discuss mainly with us this morning how to take care of ourselves and share with others how we manage daily through our ups and downs, yet remain healthy enough to assist others. And the main objective here for me this morning is that you will leave here learning more about how to incorporate spiritual self-care into our daily lives, which is a must. And so if we could move to the next slide, I will start there with giving a definition of why spiritual care for self and others is necessary. Here you see on the slide, it says our society has become increasingly disconnected, and as we age, we begin to scramble to get back some sense of wholeness. And today, our spiritual dimension of life should become more important to us as we gain in understanding that the longer the journey goes, it wears the soul down if we are not taking care of ourselves, specifically in the manner of which Dr. Johnson so eloquently pointed out. And so this is our time now to look back and see and remember that we're created in the image of God and his likeness. And so therefore, he's not passing away and he doesn't have Alzheimer's. And I do believe that if we would just listen to that still small voice within us, we will find ways to be okay with self and with others and to help those that are going through dementia crisis or Alzheimer's and their family members to know that everything will be okay and is okay, taking care of our minds and our thoughts, taking care of going and seeing our physicians about our health when we need to go and do that, increasing our own well-being through our own self-care behaviors that we must now create, not looking at Facebook and the like, but really paying attention to the Word of God and how it is trying to inform us on the way in which we are to go. Next slide, please. Understanding our existence from a spiritual perspective, there was this great article that I had read, and so I've taken this from Baha, and it says the concept of eternal life and the world beyond has been a component of the human psyche for millennia. As we get older, we have more to look back on reflectively, more life experience to contemplate. We may begin to look at the Baha teachings as they suggest for the river of everlasting life. But God promises us an everlasting life in just about every scripture we read if we would trust and be steadfast in our faith. Baha has a prayer. It goes like this: Thou seest, O my Lord, this wretched creature knocking at the door of thy grace, and this evanescent soul seeking the river of everlasting life from the hands of thy bounty. Thine is the command at all times, O thou who art the Lord of all names, and mine is resignation and willing submission to thy will, O creator of the heavens. Faith is a belief strong enough to cause one to act. And this is what we must remind ourselves of in each and every day, that if we are healthy spiritually, we will be healthy physically. because we will have paid attention to all of the things that have been foresaid by Dr. Johnson, but also all that the word feeds us on a regular basis. And so, therefore, we should have a better understanding of our existence from a spiritual perspective, because it's there for us daily to feed upon. Can we digest it all at once? No, but daily, little by little, we can eat on it, and we can have no fear. That also sets us in a bad place when we are fearful, when we're stressful, our blood pressure goes up, we are filled with anxiety. And so therefore, sometimes we get off bounds with our diets because we eat more, and we drink more, not more water, which we should be drinking, but we drink more alcohol that we should not be consuming in the amounts that is taking place, as well as oftentimes stress also causes pain. Pain has pushed a lot of people to utilize drugs and other forms of pain relief. And so therefore, let us be always mindful of our spiritual side that is within and is with us always. Next slide, please. I think daily we must incorporate spiritual self-care into our daily living for self as well as for other. And I have 7 steps and a little bit more to developing spiritual care for ourselves and others. Step 1, begin each day with meditation. This will allow us to start our day from a place, and I say lace, forgive my grammatical errors, from a place of peace, more centered and grounded. There's something about starting the morning off with prayer, meditating on the scripture that you are reading for the morning, and just get quiet. It is the best time in the morning when no one else is up but you. And if you have a loved one that is living with Alzheimer's at this time, it's a grand time to just be with them in silence and in prayer. Step 2 is to do spiritual reading and journaling 1 page a day. There's a book that I've been reading that I really have found wonderful, and it is Living Better and Doing Better. And it's a great journal because it gives you scripture, it gives you a devotional, but it allows you also to write your comments to your concerns. And I think that every day, if we just took 5 to 10 minutes out of our morning to begin to just read the scripture, study the scripture, meditate on it, and write and journal about our experience, we'll hear the Spirit speaking to us and helping us internally to move forward, to better take care of ourselves and better be able to share the word without beating people down, but sharing it with them in love and getting them to come alongside. That's when you're helping self and you're helping others. When you know that someone is going through a difficult pathway, you don't need to start browbeating them and telling them what helped you, but we need to learn how to listen to each other so that we can help differently, and leave them with a scripture and say, let me know tomorrow how you felt about that scripture. What did it do for you today? Step 3, practice gratitude. I adjure each of us to go out and get a mason jar, the jars that we use to can peaches and apples and things of that nature. If we would can the gratitude that we have, meaning take that mason jar, open it up, write down when you first wake up what you're grateful for. Grateful to, be alive today. Grateful that you're not hurting as much as you were yesterday because you changed over your diet. And so therefore you can drop your message that you wrote to yourself into the jar to come back from time to time to see how it's moving you along. Next slide, please. Step 4, spend time in nature. Swap out, as I said before, strolling through Facebook for looking at the clouds, seeing God's majesty all around us, and knowing that there's still hope in the midst of COVID, in the midst of all of the killing that has been taking place and the like. Free your mind. You know, you really want to find that place where you can be still and you can rejoice, even though you might have bills that are stressing you and the like, or your friends might have some problems and you're concerned about them. But this is a good time to take a morning walk, just to feel the gentle breeze, or if it's raining, it's okay to walk in the rain and do some other things. Step 5, be open to signs from the universe, the unexpected gifts. You never know when God has whispered to someone else that you are going through a difficult time or that you cannot make a decent meal. And so they're bringing you a meal, or they have come by just to say, you know what, I'm going to cover your gas and electric bill today. If we don't expect anything from the universe that God has created, then we'll never receive the gifts that God does have for us. Many of us can attest that we have had some phenomenal things to happen that we were not expecting, that were all great things. Step number 6, practice mindfulness. Be kind to yourself, be kind to others. Remember, listening is a great art, and it means a lot when we can listen rather than try to always advise. It is a good place to be, to hear the Spirit speak in us and take us through the spaces and places we need to go through. Stop bad-mouthing people. Stop talking about your best friend, and your best friend should stop talking about you, but talk to you. Be mindful, be gentle, be kind, be just. And then step 7, learn to say no every once in a while. That's a bad habit of mine. I say yes to a lot of things, and then all of a sudden I'm piled on. You know, people get sick, people pass away, and you need to, say, okay, how am I going to get all of this done? And Cassie has put up with me the last month or so of trying to reach me. And it was because I didn't know how to say no. And I couldn't say no to some things such as funerals and the like. And so incorporating spiritual self-care into our day-to-day living must take place, because we begin each day developing spiritual resources that nurture ourselves and others as well. And so if we start fresh with God, we can't go wrong. If we start with a smile, if we start with a desire to walk with him and feel his presence as we go, and we knock on someone's door and say, come on, walk with me today. It's a good thing to do, to get out and just, have a nice walk and come back home to a nice fresh cup of green tea. And so those are the things that I would say that we need to do. But I also want to say, if you don't know, that if we are walking with our loved ones that might have dementia or Alzheimer's, a gentle touch, if you're taking them out on a walk, will mean so much to them. Worship music along the way. My dad passed from Alzheimer's, and one of the things
Reverend
that he
Hickman,
loved.
1 minute, please.
Thank you. I'm almost done. And so my dad used to love to hear Psalm 23, and he would love to hear the old songs of Zion. And so we made certain that we kept those on pictures that he would tell us all about his past life. So self-care is, you can go to the next slide. Self-care is an act of self-love. To know the world, we must love self and others. We must look deeply within our own being. To truly know and care for self and others, we must take steps daily to enhance our wellness and love, laugh, and listen to the fullness of our lives. The next slide, please. It'll be my last one. Galatians 5:13 says, you, my brothers and sisters, were called to be free, but do not use your freedom to indulge the flesh. Rather, serve one another humbly in love. And if we could just remember the spiritual side of us, we will always do this each and every day intentionally. Thank you for this time.
Excellent. Excellent. Thank you, Reverend Hickman. I wholeheartedly agree with the importance of incorporating spiritual self-care into our regular routine. We just need to be reminded it's okay. Our final speakers are Terry Kennedy and Anna Smolesky, who are hospice care specialists at Accent Care. Ms. Kennedy and Ms. Smolesky aim to improve quality of life and access to care to persons living with dementia and their caregivers. They accomplish this by providing education on the delivery of compassionate, palliative, and hospice care, advanced care planning, and chronic disease care management. In this way, Ms. Kennedy and Ms. Smolesky empower persons living with dementia and their caregivers to make health care decisions that best meet their individual needs and preferences. Today, Ms. Kennedy and Ms. Smolesky will speak to us about navigating loss and building resilience. Before we jump into Mrs. Kennedy and Mrs. Smolesky's presentation, we ask our audience to answer one final poll question. This question will appear on the screen now. You have 30 seconds to answer the poll question. Thank you. Thank you. Wow. We have 90% to navigate the grieving process. Which of the following would you turn to for support? And 90% said family and friends. And we say support groups, spiritual leader, congregation, or faith-based community. I'm happy to see that people are using resources to support them during a time of need. Thank you for responding to the poll. Now, Ms. Kennedy and Ms. Smolesky, the Zoom stage is yours.
Thank you so much. What a wonderful introduction. Dr. Johnson and Reverend Hickman, I am blown away by both your presentations. And I have to say, I agree 100% on the holistic approach, because we know you cannot separate the mind from the body, from the spirit, from the social beings that we are. So thank you so much, both of you, for your presentations. I'm going to share my screen with you now. So let's see. Okay, so are you all able to see that? Yeah, so okay, so we are going to talk about navigating loss and building resilience. So I'm going to share this paragraph with you that I pulled from an article that was published in a journal called The Gerontologist. Grief is a universal human experience. We suffer losses and feel the anguish that follows. While it may be true that grief finds its full definition in response to death, significant reactions emerge in response to other losses as well. Bearing witness, for example, to the gradual death of a loved one's memory, personal identity from Alzheimer's disease brings a unique form of grief associated with present and anticipated losses prior to bodily death. And this is the crux of the dementia journey. All of the losses that your loved one is experiencing and incurs due to their dementia are also losses for you. So I am so happy to see that almost half of you, 46% of you, say that you belong to a support group. I would say this is the number one thing that you should do if you love somebody with dementia and if you're caring for them, is join a peer support group. People that are in similar experiences to yours. If you take one thing away from my talk today, I would say that would be the biggest thing. So we, loving somebody and caring for somebody with dementia, we suffer different losses. And here are some of those. You are still living in this world. You are still living your life and a part of this world. So you suffer the losses that everyone experiences while simultaneously suffering these losses due to your loved ones having dementia. When we love someone with dementia, it is important to understand the disease. Dementia is progressive. So this day, right now, is the best day that your loved one will have for the rest of his or her life. Each day is their last best day. And you might think, that sounds really sad. Why do you want me to remember this? Because it's important that we keep in mind that our loved ones are declining and not improving. And although that does sound sad, this is important because understanding and accepting the disease for what it is helps us to accept our situation for what it is, and helps us to grow and build resiliency rather than fall apart. Now, we are bound to have moments where we fall to pieces, but this too is a part of building resiliency. So here are some themes to navigating loss and building resilience, and we just have time to touch on each one of these. But you might be thinking, why are they combining navigating loss and building resilience? Is my time of grief really the time to, expect myself to become more resilient? And the answer is yes, the two go hand in hand. So let's take a look at these topics. Traditionally, we think of loss as loss due to death, but non-traditional loss are those losses we just mentioned due to our loved one having dementia. These losses are considered ambiguous losses. Ambiguous loss is loss that occurs without closure or clear understanding. So it leaves a person searching for answers. And this can complicate and delay the grieving process and often results in unresolved grief. There are two different kinds of ambiguous loss. The first one is when the person is physically absent, but psychologically present. So that's like when somebody goes missing, right? So they're not physically there, they're physically absent. You can't touch them, you can't talk to them, you can't see them. But they're psychologically present because as far as we know, they haven't died, they are just missing. So they are still psychologically present with their loved ones. The second kind of ambiguous loss is when the person is physically present, but psychologically absent. And that is the kind of loss that we face loving someone with dementia. Now, ambiguity is not something we welcome. We like clarity. We want absolute answers. Neuropsychologists have found that the human brain doesn't like ambiguity. And when faced with it, will go to great cognitive effort to come up with clear and decisive solutions. So the human brain inherently tries to eliminate ambiguity, but dementia creates ambiguity. The duality of your loved ones being absent and present at the same time is confusing, and it makes understanding your situation hard. So all grieving or all loss is met with grieving, but grief presents itself in different ways. When we lose someone due to death, there are rites and rituals that help us with this process. And people come to see you, family rallies around you, friends check in on you, neighbors bring you casseroles. But ambiguous loss is different, and it's not well understood. There aren't rites and rituals to help you with this kind of loss. People aren't coming to see you. Family isn't rallying around you. And instead of checking in on you and bringing you casseroles, people are asking you questions like how your loved one's doing without really wanting the real answer. And they don't ask you how you're doing. Now, I facilitate some peer support groups for caregivers with loved ones with dementia across the state. And in my groups, I've had a lot of people tell me that people will say things to them like, you should just consider yourself lucky that your mom is still alive, that you still have her. And these people tell me that this can make them feel angry, because that statement in and of itself is rife with ambiguity. Are you lucky? Is your mom even lucky? So ambiguous loss and non-traditional grieving also introduce another emotion. It rears its ugly head, and that is guilt. And if I hear one emotion talked about more often than any others with the people that are in my support groups, it's guilt. People who love someone with dementia suffer so much guilt. So I'm just going to remind you, be a part of a support group. I am happy to have you join one of my groups. You can Google groups. You can find them anywhere. Let me know if you would like to join one of my groups. And like I said, I'm happy to include you. I do keep them limited to a certain number of people, but if I need to create a new one, I will. It is my passion. People need this support from people going through similar experiences. So let's look at reaction versus response. Grief reaction is like, it's like an impulse, like a reflexive reaction. So a grief reaction is something we have to feel. It's not within our control. And we experience grief reactions not only emotionally, but psychologically, spiritually, socially, and even physically. And this grief reaction is our immediate experience with loss. And then we experience grief reactions in moments episodically thereafter. And sometimes we can determine what is triggering these reactions. But a lot of the times we don't know the catalyst behind these painful reactions that we are thrown back into. So a grief reaction and grief response are different. Your grief reaction is exactly that. It's a reaction, where grief response is a choice. So grieving isn't only what happens to us, it's what we do with what happens to us. And where we have to feel that reaction, we have a choice with what we do with that afterwards, how we respond to that. So as we suffer losses, the world changes for us. And we have to discover ourselves in this new world post-loss. And we are trying to grow and adapt. And we do have choices, and that is empowering. So another thing that is really important to remember is that there are things we can control and there are things that we just can't control. And resilient people have a few things in common. And one of those things that they have in common is determining what is within their control and what is not within their control, and then not attempting to control things that are not within their control. And this is important because when we attempt to control things that we cannot control, that is a cause for anxiety. So it is really important to remember that there are just certain things we can't control. And with all the ambiguity that dementia presents, there is a lot that is not within our control. We really have to give up a lot of control. And that's hard because as human beings, we like to feel in control, and we live in a control-centric culture. So come up with some things you absolutely can control. Every Wednesday, I'm going to have my niece come. She's willing to come and sit with my mom for 30 minutes while I take a 30-minute walk, so that I know every Wednesday I'm taking a 30-minute walk at 3 o'clock, and that is something I can control. So come up with something you can control so you don't feel completely out of control.
Ms. Kennedy, 1 minute.
Okay, so we're going to fly through this. So also know that you are doing the best you can. We put a lot of pressure on ourselves to always be our best, to be the best daughter, the best caregiver, the best neighbor, the best husband. We put a lot of pressure on ourselves, and we can retrospectively look at ourselves and be very cruel to ourselves. And I like that Dr. Hickman said, be kind to yourself, because we can only do the best we can do with the situation we're in. So I always tell people, say to yourself, don't look back and berate yourself for opportunities you think you could have been more patient or kind. You did your best in that situation. So tell yourself, I did my situational best, and that is all anyone can expect of me. That is even all I can expect of me. That is the best you can do. And that is the best any of us can do. So always remember that. This is an important topic, but I don't want to go beyond my time. But remember that if you want help joining a support group, finding a peer support group, or if you would like to be in one of mine, I'm happy to have you. But this is so crucial. You need this support, and you need it from people who understand this journey. And in these groups, people are in different places all along this journey. So you can be very, very helpful to each other, and you get to support them as well, which feels good. So I am now going to turn this over to my colleague, Anna. And Anna is going to go through some resources for you all.
Thank you so much, Terry. Wonderful being here with you all. I'll take just a quick moment along this. So building resilience as a caregiver and patient is having a care support network as well. Engaging in conversation with your healthcare providers about specific options and resources available within your plan of care unique to you. And there's different options that come alongside of that when we're focusing in on aging in place. So a couple things that we always are mindful of is being able to have some of those options and resources, for example, home health in times of rehabilitation. And then also something that we specialize in, Terry and myself, is the hospice benefit in times of maximizing comfort and quality of life within your chronic disease management. These are benefits that are available to you all, and a couple different options of how we can access that. So some things that I just want to make sure everybody's aware of is the local resources. Maryland Access Point is able to really create a long-term care plan for access into different resources available to you all in specific zip codes that you're in, and really empowers you to have an aging in place option as well, and also any placement options needed. The Department of Aging Community Resource Guide, really something that is able to create some other additional options and empowers you for further guidance as the different chapters of your chronic disease management continues. And also something else just want to make sure everybody's aware of is advanced care planning. The importance of advanced care planning, it's an important element in leading a successful medical care journey as we continue to progress through different chapters in our lives, and it gives us the power to be in charge of our options within all chapters of our medical journey. So a couple options and resources for that piece is the conversationproject.org, which really helps create a nice plan and a sit down with whoever you choose as your medical decision maker and your family as well. Also, NHPCO is a network that we utilize for hospice and palliative care that really helps build options around advanced care planning. And the caringinfo.org is also another way that we can utilize some further resources to really build on understanding advanced care planning, but also what are some resources and medical documents that we can utilize in making sure that we have everything in place that we need. And our website, accentkare.com, we do have a lot of information about understanding what hospice is, what palliative care is, and making sure that everybody has the power of bereavement support as well. That is something very crucial and important in grieving process. And as Terry mentioned, there are such great grief support groups hosted by Terry. We also will have in the resource packets a option around the different support groups that we have all throughout Maryland. So we thank you all so much for being a part of this, and we look forward to continuing our great work in this area and empowering all of you.
Thank you all so much. And so again, your grief response is a choice. And so we can choose to create moments of joy and we use those as the memories that we have. But it all takes supporting each other, loving each other. Like someone said earlier, it takes a village.
Thank you so much, Ms. Kennedy and Ms. Smolesky, and all of our expert panelists. We definitely found your presentations to be very informative and full of very valuable information, and we hope that our audience did as well. Panelists, we would like you now to turn on your cameras for our panel Q&A session. And audience members, just a quick reminder, please remember that you can type your questions into the Q&A box at the bottom of your screen, and your questions will be read by our moderators. All right, so Dr. Johnson, let's start with you. There's a question in the chat about, does eating oatmeal daily for breakfast provide too many carbohydrates for an individual whose A1C is at pre-diabetic levels?
The answer to that is no. The benefits of oatmeal far outweigh the calories that you're taking in. Relatively speaking, the oatmeal is very high in fiber, so you're not actually absorbing all the calories that are in the oatmeal. And that's one of the things that we think is that these higher fiber diets have something about the fiber that is really helping not only our cholesterol, but also really binding the calories in an interesting way so that they are absorbed much slower. So instead of a refined sugar like a donut or a white piece of bread, those are absorbed very, very quickly. The oatmeal is much slower, and as a result, your blood sugar level only rises gently and then falls gently rather than like rockets and coming back down. So the oatmeal is really a very, very good carbohydrate choice. So I think that that's great. And it has this extra benefit of reducing cholesterol in very interesting mechanisms that I don't think we fully understand, or at least I don't fully understand it right yet. I haven't read into it too much, but I know that the fiber in the oatmeal, in particular, the steel cut oatmeal, is really great at reducing cholesterol and a great way of controlling that. And as far as blood sugar goes, it's certainly not at all like white or processed flour. It's much slower in and much slower down. So in a way, it's helping you control that blood sugar out of all the possible foods you could eat. And so, yes, oatmeal is a wise choice.
All right, I have a question for Reverend Hickman. The person that says, I've become good at adding things to do my daily schedule and organizing a time out of my daily schedule to practice self-care. But I oftentimes find that my schedule for the day keeps getting pushed back, and then I'm too tired to practice self-care. Any advice?
Yes, my advice is that outside of God, the next person that should be on your schedule is you. And that means that you put aside all of those other things. You get up a little earlier and you actually begin to set a pattern for yourself. My pattern is 4:30 a.m. in the morning to get up, to read, to have prayer, and then go and get a good workout for about an hour. That does not mean that it will work for you, but you have to structure yourself and say, is this what I want? And I had to tell myself that this is what I want and what I must do, because the evenings don't work for me. And in between, if I didn't do it then I'm going to be off grid a lot.
Thank you. That was excellent. The next question that we have is for Ms. Kennedy and Ms. Smolesky. Could you touch on the difference between palliative and hospice care?
Yes. So, and Anna, you're welcome to chime in as
Yeah.
well. Hospice care is end of life care. So, and palliative care, so they're both symptom management. Both we're looking for the comfort and the quality of life of the person we're serving. But palliative care is usually in conjunction with aggressive disease-centered care. And hospice is more when you've given that, not given up, that was the wrong term, but like where you are not any longer aggressively trying to fight a disease that really, most of the diseases we die from, almost all of them, there's no cure. So there does come a point where it makes more sense to keep your symptoms managed. And you actually, if you do that early enough, if you get hospice as soon as you can, research shows that people will live longer that get hospice earlier with the same diseases, because we keep you from getting sick. We keep your symptoms managed. So, but palliative care, you can have even more upstream, and you can have it in conjunction with very aggressive disease-oriented treatments.
Absolutely. And one other thing just want to touch on is for hospice, just be mindful that, it's in the events of a poor prognosis, but understanding that, it's that 6 month or less prognosis piece. And we're focusing in on high level symptom management and making sure that aging in place is a large factor into this. So the benefit is probably the most robust benefit you can have under insurance. And being able to have access to that consult, anybody can access that. So by all means, reaching out to the provider, your healthcare provider, to make sure that they're placing that consult so that assessment and the next part of that benefit can be truly up to you, of course. So just want to make sure everybody's aware of that. And it is definitely a great benefit in aging in place during chronic disease management. And that end of life chapter that comes up as well.
Yeah, I just to piggyback on that, I would say don't wait until you think your loved one has 6 months left to live. Upstream, ask to have a consult upstream. A hospice nurse will come out, or a consultant like Anna. They'll give you all this information, and yeah, if you do it upstream enough, they'll look at your loved one and say, look at everything about him or her and say, well, although they can't access the benefit right now, we can continue to check in with you if you would like us to, so that as soon as they can, we can try to get these services to you. And the services are amazing. It's so much help. So I always tell people who have loved ones with dementia, do that way before you think. Just have that ready, get that information.
Good information. This is another question for Dr. Hickman. Reverend Hickman, what was the title of the book journey you mentioned for self-care?
It was Believe Bigger. I said the wrong name at first, but it's called Believe Bigger. Believe Bigger. You won't go wrong. It's something there for every day. You will not go wrong with that book.
Great. Thank you.
I'd really like to thank our panelists for taking the time to present and answer these wonderful questions. We do have some additional questions in our Q&A box. If the panelists could continue to respond to them, that would be very much appreciated. And Ms. Ernestine, I'll pass it back on to you.
Okay. Thank you for those wonderful questions, and thank you again to our panelists. You were excellent. We know that physical activity is good for the heart and brain and can help us manage stress to improve our overall health and wellness. It is therefore my pleasure to introduce Ms. Courtney Brown, who will be leading an interactive yoga and meditation demonstration. Ms. Brown is a certified yoga instructor, mental health, first aid provider, and purpose coach. She developed the Gospel Yoga Flow, which is an approach to yoga that focuses on strengthening the spirit and mind, as well as the body. And this, of course, perfectly captures our seminar's theme. A big welcome to Ms. Brown.
Okay, can you all hear me and see me?
Yes.
Technology, right?
Right.
Yes, I'm so glad to be here with you this morning just to share a little bit about how movement and mindset can be really powerful tools when we are in a position of being caregivers, or we find ourselves dealing with a challenge related to memory and aging. You know, one thing about aging and memory loss, right, is the acceptance of the fact that it is a part of the life cycle. A lot of times our needless suffering comes from, I'm sorry, I got distracted by the chat box, comes from living in a different moment, right? Earlier, and I apologize for not being on earlier. I was teaching a class here at my studio, but I know earlier there was some discussion about making time for movement, and yoga is a lifestyle, right? And most times when we see or we hear about yoga, we see, you know, people doing poses like headstand, for example, or some very extreme or intricate yoga pose on some yoga magazine or, God forbid, Instagram, right? But yoga really is a lifestyle. And the reason that we practice yoga is to calm the fluctuating mind. So as we're moving through life stages, if we can stay focused on the fact that this experience that we're having is just a moment, right? In the grand scheme of all the other moments, it really helps us to not suffer as much. So I want to offer to you today a few breathing techniques, and then if we have time, maybe some gentle movement activities. But again, going back to what yoga is and what yoga is not, yoga is a lifestyle. And when we talk about yoga poses, that's just one aspect of what a yoga practice is. The most important aspect of yoga, in my opinion, is the management of the breath. And we call that breath management pranayama. Prana is a word that means life force energy, right? And we all come to this world with a certain amount of prana within us. And it's up to us to use that life force energy in a way that empowers, right? And promotes a sense of general well-being. So managing prana through breath work is one way that we can keep ourselves present and keep ourselves aware of all the blessings that are surrounding us, despite what our current situation might be or what it might feel like. So I don't think you can see my whole body here, but I am seated in a comfortable position. We call it Sukhasana in yoga. It looks like crisscross applesauce, right? But I'm going to invite you to sit in a way that's comfortable wherever you are. So if you happen to be sitting in a chair right now, just make sure that you feel very connected to your seat, right? You feel, if you move around from side to side, shift around, you feel a connection, your gluteals to your chair. Okay, and your feet are firmly planted on the floor. So that's if you're seated in a chair. If you're sitting on the floor like I am, again, just make sure that you can feel at the base of your tailbone, there's these two bony bones, there are sits bones. Just make sure you feel some connection to whatever surface is supporting you right now. All right, and then we want to sit up straight and tall. We want our shoulders directly above our hips. Your chin is going to be parallel to your seat, and the crown of your head is going to be parallel to the ceiling. Good. And just draw the navel in towards the spine a little bit. Drawing the navel in towards the spine. And let's see if we can relax our shoulders away from our ears. Generally, we walk around through life like this, right? We're in a constant state of like fight or flight. And the shoulders are always somewhere way up high near your earlobes, right? Imagine, I mean, just do that for a sec. If you're already in a rested posture, great. but I want you to just shrug your shoulders up to your ears, right? And feel the difference that that creates in your whole body, this position of tension and stress, yeah? Now roll your shoulders back and down and notice the difference that creates in the mind and body, right? You feel that? Now we're gonna start to find the breath, prana. We're inhaling in and out through the nose, and the reason we breathe in and out through the nose is it's very calming to the nervous system. So it gets us out of that flight or fight mentality. So let's just take a few deep breaths in and out through the nose. And just notice how that feels. Just breathing. Notice if the shoulders start to want to creep back up towards the ears and just rolling them back and down. And breathe in and out through the nose. Generally, we breathe right into the chest area, right? And that is a shallow breath. Life-giving, yes, right? But it does nothing to reduce stress or suffering. What we want to begin to do with the breath as we breathe in and out through the nose, begin to draw the breath all the way down into your belly. Maybe taking both hands, right? And placing your hands on your belly, soft. Just rest your hands on your belly. Notice if the shoulders did this and just roll them back and down. Rest your hands on your belly and breathe deeply here, in and out through the nose. And try to inflate the belly so that you feel your belly pressing against your hands on the inhale. Yeah, and then as you exhale, you're going to draw the navel in towards the spine. You're going to feel your belly start to move away from your hands, your fingers, your palms. Inhale, fill it up. Let the belly fill up with air, deep breath, all the way down into the belly. And then exhaling, drawing the navel in towards the spine. Yeah, feeling the belly move away from the hands. Just a couple more rounds. Let's do that 3 more times. Inhale all the way in. Exhale all the way out. Good. Inhale. Exhale. Last one. Deep breath in. And exhaling. Good. Just return to your normal breath. Rest your hands anywhere that feels good. You know, normally when we are in a position of being a caregiver, right, or we are in the position of dealing with some memory loss ourselves, there comes this feeling of fear, right? Maybe even anger, maybe resentment. And those feelings are just that. They're feelings. What happens with this, when we start to engage with those feelings, we start to see those feelings as being a part of who we are. And that is false. Those are feelings. Those are feelings that we are having in the moment. And what's going to enable us to move past the moment and continue in our role as caregiver or to move through our healing, right, is recognizing that that's a moment. That is a feeling that I'm having, but that feeling is not who I am. So I am not resentful. I am feeling a moment of resentment, perhaps for how this is impacting my life, right? I am not afraid. I am feeling a moment of fear for this challenge that I'm currently facing. So the next breath technique that I'm going to share with you is to build an awareness of the emotion, right? And learn how to recognize that it's there, but then to release it, let it go. So it doesn't begin to take root in your mind and body and have you move in ways that say you agree with a thing that is not true. So get honest, just go with me for a minute. Let's be courageously curious, right? Just take a moment, resting your palms on your knees, palms face down, because that tends to ground our energy. Become aware of how you're feeling emotionally and energetically right now. Maybe you feel a little tired, right? Maybe a little hungry, but just become aware of what emotion is holding space in your body right now. What emotion? And if you find an emotion or a thought that is disempowering, right, that is somehow debilitating you or bringing you down energetically, I'm going to encourage you to replace that negative emotion, that feeling, with a positive one, like immediately. This is the way that we build our mental muscle, and we're able to take ourselves from perhaps a negative environment in the mind to a positive environment. And that gives us more access to energy and allows us to do whatever it is that we are having to do in the moment. Okay, so whatever emotion is there. I'll give an example of myself. I just taught a yoga class, right? I'm feeling a little sore, a little tired. So what I'm going to do instead, so that I don't agree with feeling sore and tired, I'm choosing a thought that says, I feel energized and able. So when I inhale, I'm inhaling the sense of I am able and I am energized, yeah? And I'm exhaling feelings of soreness or feeling tired. So just try it with me. Inhale whatever opposite positive attribute you can identify towards a negative attribute, right? So inhaling power, maybe.
Ms. Brown,
And
1 minute.
fragility. Inhaling grace, perhaps, and exhaling fear. Let's just take 2 more. Your emotion, the positive, then exhaling the thing that doesn't serve your highest good. 1 more, inhale the positive, and exhaling the thing that doesn't serve highest good. So I understand from Rossi that I have 1 minute. I'm going to finish up then with what we call the box breath. It's a 4-part breath that really helps to alleviate stress quite quickly. And you imagine a box, right? So we're drawing our breath. Here's our box. Here's the top of our box, the side, the bottom, and the other side. So as we inhale, we're inhaling across the top of the box, deep inhale. Exhale as I draw my finger down. Inhale as we draw the bottom of the box. Exhale as my finger comes up. Once more, inhale. Exhale. Inhale. Exhale. Good. The box breath is really helpful if you need a visualization tool while you are breathing. Use it as a caregiver, use it as the person that you are providing care for. The breath is everything. Preserve your prana. The more life force energy you make available to yourself through your breath, the easier it is for you to deal with life's challenges. Thank you. I'm happy to take any questions if there are any. Oh, good, Corinne. I love the box visual for sure. And you can even print it out. You can just go ahead and print out a box, make the borders your favorite colors, right? Blue is my favorite color. Print a blue box and use that, hang it in some place where you can see it when you need to remind yourself that the breath is my control source. Absolutely.
Wasn't that wonderful? I hope you enjoyed the demonstration and your body feels restored. I know mine does. Being physically active can be beneficial to your health in many ways. So I encourage you to find activities that you enjoy that are safe for you and try to incorporate those activities several times each week. Don't forget, always consult with your doctor before engaging in a new exercise program. Now it's time to pivot to our special recognitions program. It is now my honor to present this year's recipient of the Holistic Health Seminar Awards, including the Trailblazers Award and the Outreach Leadership Award. This year's Trailblazer Award goes to someone who is dedicated to empowering older adults by fostering a culture that reveres older adults as assets. Mrs. Betsy Simon is the founder and president of the BDS, Healthy Aging Networks Incorporated. She is dedicated to engaging, empowering, and educating the communities she works with. Her current focus being on older adults. As a nationally certified health education specialist, Mrs. Simon has helped develop and implement over 20 healthy living models, both in the greater Baltimore area and across the country. Notably, she uses an intergenerational approach to form networks that provide education, resources, and advocacy for older adults and help address the social deterrents of health in our community. Mrs. Simon was previously a professor and an administrator at Coppin State University and has held numerous positions with city and state advisory groups addressing the needs of older adults. For example, Mrs. Simon actively serves on many advisory committees, including the Diversity and Inclusion Committee at the Alzheimer's Association, Greater Maryland Chapter, and the Scientific Advisory Panel of the Johns Hopkins Alzheimer's Disease Research Center for Minority Aging Research. Without further ado, I am pleased to present this year's Trailblazer Award to Mrs. Betsy Simon. Mrs. Simon has recorded a short video acceptance, which we will play now.
Good morning, everyone. First and foremost, I thank God for our very presence here today in this virtual world. And we are extremely blessed, realizing all the trouble around our country and the world. I know I speak for everyone here when I say that this has been an awesome experience today. Just the right mix of science, fun, gratitude, and hope. I'm so honored to be a small part of this tremendous work that McCAB has been doing and continues to do. I've heard the Trailblazer used many times, often referring to those events or persons who push through and push down to blaze trails to victory or success. So for you to feel that I'm in some way deserving of such an honor, I'm amazed, honored, and feel challenged to do more, ensuring that I create a trail wide enough for many to travel along beside me. Actually, this honor today has been made possible because of those who have traveled along beside me and often ahead of me throughout the years, especially over the last 2 years. To all of you, I say thank you, because I know that for the long haul, you will join me as we continue to engage, educate, motivate, and empower ourselves, and especially those underserved in our communities. To the members of the BDS Healthy Aging Networks family, the BDS Network Support and Advisory Team, and all of our community providers and partners, thank you so much. Many, many thanks. To the Memory and Aging Community Advisory Board, thank you so much for this very special award. To my husband, Deacon Henry Simon, my supporter, my sponsor, my advisor, my all in all, thank you for a lifetime of service with me. And thank you all again as we continue to serve together.
What a lovely acceptance. Thank you again, Mrs. Simon, for your service to the community. The second award presented today is the Outreach Leadership Award. It is my great pleasure to present this year's Outreach Leadership Award posthumously to Mr. Robert Tompkins Roselle Jr. Mr. Roselle and his sister Peggy Jackson together cared for their mother when she was in the later stage of Alzheimer's disease. In addition, they founded the MAR Alzheimer's Caregivers Support Group at Sharon Baptist Church, which continues to provide necessary resources to caregivers in the greater Baltimore area community. Mr. Roselle was a lifelong learner who was dedicated to becoming more knowledgeable about Alzheimer's disease. In addition to attending seminars and being active with the Macabre, he enrolled in graduate studies in gerontology at UMBC so he could better serve older adult communities. Mr. Roselle was also a dedicated advocate for Alzheimer's disease awareness, patients, and caregivers. He made an impact on all who knew him, and his passion for making a difference in Alzheimer's disease education. Although he's no longer with us, he made sure others could continue to learn more about Alzheimer's disease by generously and selflessly donating his brain to research. This year, it is my pleasure to posthumously award Mr. Robert Roselle Jr. the 2022 Community Outreach Award in recognition of his dedication to advocacy for Alzheimer's awareness, research, patients, and caregiver support. In honor of his accomplishments and to encourage our audience to continue his advocacy efforts, the family of Mr. Robert Roselle Jr. would like to host a special raffle giveaway to our wonderful seminar audience members. For this raffle, a Visa gift card certificate will be awarded to the 50th attendee listed on our moderator's screen in recognition of Mr. Roselle's birthday. Ashley, could you announce the winner?
Thank you, Ms. Ernestine. Mr. Roselle and his family will be awarding a $100 Visa card gift certificate to our lucky winner, Karen Jackson. Congratulations. After the event, we will send you additional instructions on claiming your certificate to the email you used to register for today's event.
Thank you, Ashley, and thank you to the winner. We would like to now share the posthumous acceptance of the Outreach Leadership Award by Peggy Jackson, sister of Robert Roselle Jr. As before, this is a brief video recorded by Ms. Jackson.
On behalf of Robert T. Roselle, his two children, myself, and our entire family, I graciously accept the 2022 Macabre Outreach Community Leadership Award in recognition of Robert's dedication to advocacy for Alzheimer's awareness, Alzheimer's research, and caregiver support. As you may know, our mother, Myrtle A. Roselle, battled Alzheimer's for more than 17 years until her untimely death in 2012. During that time, Robert, other family members, and myself selflessly and continuously were responsible for her primary caregiving. Robert, at that time, learned firsthand, along with each of us, the debilitating effects of this lasting and insidious disease. Subsequently, this experience made all of us steadfast in our commitment to strive to improve Alzheimer's treatment and support continuous research on memory loss and aging. Robert worked for Baltimore City as an ombudsman, and he worked tirelessly in his task to share knowledge of available resources for those persons in the senior community who are suffering with memory loss. He was a dedicated employee. To this end, upon his death, he donated his brain to science. Therefore, we graciously appreciate the recognition of Robert bestowed upon him and accept this award. Thank you.
Wasn't that excellent? Congratulations again to our two award recipients, Mrs. Betsy Simon and posthumously Mr. Robert Tompkins Roselle Jr. And congratulations again to our Raffle Giveaway winner. Before we conclude today's event, I would like to take a moment to remember and honor a beloved macabre leader who passed away last fall. Mrs. Henrietta Wallace led a very active life, which was rich in volunteer activities. She was passionate about community service and gave her volunteer time and energy to causes she believed in. For example, Henrietta was a long-standing member of the Macabre, having most recently served as the board's co-chair. She also was my soror in the Baltimore County Alumni Chapter of Delta Sigma Theta Sorority Incorporated. Additionally, she served as a helpline volunteer with the Greater Maryland Chapter of the Alzheimer's Association. Mrs. Wallace was also a loving mother, grandmother, and sister. She had a generous heart, a beautiful spirit, and a smile that could brighten the room. We are grateful for her dedicated service, and she is greatly missed. As we bring today's event to a close, I would like to leave you with this call to action. First, I urge you to use the knowledge you gained today to be your own health advocate, particularly as it relates to your brain health. Care for your spiritual, mental, physical, and brain health by leading a physically active lifestyle, adopting healthy nutritional practices, staying socially engaged, and enjoying cognitively stimulating activities. Leading a healthy, active lifestyle also helps build resilience against loss and improves our overall well-being. And remember, if you're not sure where to start, take one step at a time by adopting these habits gradually. Additionally, be sure to discuss any health concerns with your doctor, because oftentimes early diagnosis is the key to disease management or treatment. Second, consider participating in research studies on topics related to aging, brain health, and memory loss. Clinical research is critical to finding new treatments for Alzheimer's disease and other types of dementia, and for understanding the ways in which we can maintain our brain health as we age. It also helps provide an understanding of lifestyle, health, social, and personal factors that impact physical and mental wellness. You can learn more about research opportunities from the Johns Hopkins Alzheimer's Disease Research Center at www.alzresearch.org. Third, take action to manage your stress levels. Caring for a loved one with dementia or grieving the loss of a loved one can be overwhelming. But as we heard today, there is a vast array of available resources and activities for managing stress and loss and building resilience. For example, caregivers can seek out support groups in the community to share caregiving strategies and experiences of bereavement. Remember, you are not alone. You are not alone. And if possible, explore resources on respite care to find the time you need to manage stress in the way that works best for you. Finally, I urge you to continue to educate yourselves about health and wellness, especially as we get older. There are many resources and services available online, with information becoming more accessible every day. As we transition to the next stage of the pandemic, many support groups and services are returning to in-person activities. We encourage you to take advantage of these resources for continuing to grow. Consider what you can do and what you can control. Then make changes to those aspects of your life. Take action. Now, I'd like to invite the chair of the Memory and Aging Community Advisory Board's Community Education Committee, Ms. Anna Smolesky, to turn on her camera to leave you with some closing remarks. Anna?
Ernestine for emceeing today's event, and thank you all for attending our seminar. A few quick reminders before we end today's session. First, please consider staying online for the optional 45-minute session on healthy living for your brain and body. This session will be presented by the Greater Maryland chapter of the Alzheimer's Association, beginning right around 11 a.m. We will be using the same Zoom link, so there's no need to log off. Next, we are asking all attendees to complete the event survey. The link to the survey has been placed in the Zoom chat. It will also be distributed by email within the next few days. As a token of our appreciation, the first 200 individuals who complete the survey will be entered into a raffle drawing for one of 4 $50 Instacart gift cards. In addition, we will be mailing a special reusable tote bag to the first 200 people who complete the survey. We invite you to carry these tote bags proudly in the community. In addition, you should have received a virtual folder by email. Please be sure to explore the host of included resources and don't hesitate to reach out to us if any additional information can be provided. Our final reminder is that a link to today's seminar will be made available on our McCAB website. This information will also be sent by email. And for additional resources related to healthy aging and memory loss, we invite you to follow the Johns Hopkins Memory and Aging Facebook and Twitter pages. Thank you again to all of our speakers, sponsors, and of course, our wonderful audience. This event would not be possible without you. Please be sure to join us next year on the first Saturday in June, and be sure to bring a friend. We extend our warmest wishes to all of you for healthy aging, self-care, wellness, and peace of mind. Thank you again. A quick reminder, if you are attending the optional session on healthy living for your brain and body, led by the Greater Maryland chapter of the Alzheimer's Association, please stay on this Zoom session. We will begin momentarily. For those not staying for the optional session, you are welcome to sign off this Zoom session now. Thank you all.
All right, thank you all so much. We appreciate you staying on for the Healthy Living for Your Brain and Body presentation given by the Greater Maryland chapter of the Alzheimer's Association. This session will be led by Mr. Larry McNeely. At this time, I'd like to invite Mr. McNeely to turn on his camera, and I will be sharing the slides on his behalf. Mr. McNeely, the stage is yours.
Thank you, Russ. Thank you. Let me share the screen with you. Someone else is sharing the screen, so I can't do that.
I will stop share then. And please remember to share your computer audio for the videos, please.
All right, can you hear me as well as see the screen share, Rossi? Great.
Yes.
To everyone, thank you for staying. The Alzheimer's Association has been a great support for me for 18 years. That's when first found out that that illness was with my mother. My wife and I were the caregivers of her. Attended support groups and read the 36-hour day and started then an 18-year search and study into Alzheimer's and dementia. A little bit about me. I've been a counselor for 50 years and have 3 children and one grandson. We moved here to Maryland soon to be 7 years ago, to be close with that grandson, which is a great experience. And unfortunately, 20 months ago, I was widowed. So I'm progressing through that process at the same time. What I'm going to be presenting to you is healthy living for your brain and your body. And these are tips that the Alzheimer's Association has developed based on their latest research. And it's to offer you research-based recommendations about the care of our brains and our bodies in order to be as well as possible. These have been—
Mr. McNeely?
Yes.
Could you please put your slides in presentation mode? In the bottom right corner next to the minus sign, there's a little icon.
Oh, right. Does that have it for you, Russi? Thank
Great.
you.
Yes, thank you.
And thank those of you attending for my approach and not understanding. The young people that have been part of this are truly impressive. If I may ask for the next slide, please. What we're going to— Go ahead, Rossi.
Would you like me to share slides on your behalf?
Oh, yes, Rossi, please share the slides for me.
Great. If you could please stop sharing your screen.
Oh, okay. You can do that completely from your end. Good. Great. Okay. So The areas that we're going to be looking at are the importance of exercise, which has been discussed, diet and nutrition, thinking, cognitive activity, and social engagement. Next slide, please. Let's start by talking about the factors that contribute to how human beings age. There are some ways in which we age that we all have in common, and many of these are outside of our control. As older adults, for example, our hair typically turns gray, our skin wrinkles, our eyes tend to focus less effectively while reading, and our ears and nose grow. As individuals, though, we each age somewhat differently, and how this takes place depends in part on our genes. We are each genetically predisposed to age in a certain way. For example, some families tend to live a long time, aging well into their 90s and even longer. Other families tend to develop diseases that may limit the lifespan. These things are all beyond our control. However, there are some aspects of aging over which we do have some degree of control. These aspects of aging include lifestyle or environmental factors associated with how we age. Even in families with genetic predispositions towards particular conditions, there are lifestyle and environmental interventions that may alter the course of those conditions significantly. We can start by adopting habits to potentially improve our overall health. These habits may keep our bodies and our brains, these habits may help keep our bodies and our brains as we age. Next slide, please. Thank you. Now, let's talk a little bit about the brain and how it works. The brain controls all of our bodily functions, including thought and movement. It is the control center for the entire body. There are approximately 100 billion nerve cells, called neurons, in the brain. They are structured like the branches of a tree, creating a network of pathways through which electrochemical agents are sent to form thoughts, feelings, and memories. Alzheimer's disease progressively destroys brain cells as it moves throughout the brain, affecting more functions as it progresses. Next slide, please. We have known for years that the body and the brain are connected, and that what is good for the body may also be good for the brain. Now science is able to tell us why this is true and what we can do to maximize health. Much of the body-brain connection is due to the fact that the brain is nourished by the body's richest network of blood vessels. The oxygen and other elements delivered through the brain, through the bloodstream, keep the brain nourished. Every time your heart beats, 25% of the blood is being moved to your brain, which weighs approximately 3.5 pounds. This is why keeping the body in good working order helps keep the brain fueled to do its work. There are many benefits to aging. Next slide, please. If you ask someone you know who is over the age of 50 or 60, you may hear a discussion of increased feelings of comfort with the who the person is, and less concern with the opinions and criticisms of others. Those in their 70s and 80s may talk about the wisdom that comes from life experiences and their appreciation of this perspective. As we age, there are changes that take place in our bodies and our brains. Many of these things are to be expected as typical age-related changes. Such as some decline in the ways our brains process information. In addition, however, there are some diseases that are more common as we age, and some of these impact brain functioning. Alzheimer's disease and other dementias result when the brain is compromised in some specific way. Currently, there are no proven methods to prevent, cure, or even slow the progression of Alzheimer's disease. There are habits, though, that help maintain or potentially improve overall health as we age. These habits may also help keep your brain healthy as you age. Although this program isn't specifically designed about issues related to Alzheimer's disease or dementia, it's helpful to know some basic information about these conditions to understand how they relate to healthy aging and what we can do to help our brains and our bodies as well as possible. Dementia is a general term that is caused by many different diseases, each with a different symptom. The symptom of all these diseases have one thing in common. They compromise the way the brain works and cause a decline in the memory or other brain functions that are noticeable enough to affect everyday life. Although dementia and the diseases under this umbrella are associated with aging, they are not a normal part of aging. If they were, everyone would develop them as they age. And as we know, this isn't the case. Alzheimer's disease is the most common form of dementia, according to 60 to 80% of all the cases. Some of the risks include age, genetics, head injury, cardiovascular factors. Next slide, please. And fewer years of formal education. We will discuss each of these in detail later in the program. There are some therapies that have been developed to help treat symptoms, and these are effective in some people for a limited time. However, they do not change the progression of this disease. The Alzheimer's Association offers resources, both in person and online, where you can get additional information, attend a seminar like this virtually, and get great support. One factor that as caregivers or care partners and persons living with dementia that I have found in my research is that people are reluctant at times to interact or move forward with others when this illness comes about. And I urge everyone to not let that impede you from interacting and being with people who have this partnership to work through this illness together. We're going to look at healthy aging. Again, physical health and exercise, diet and nutrition, cognitive activity, and what I was just speaking about, social engagement. We'll take a look at what the most current research tells us about change and what we can make in each of these areas that can help our bodies and our brains be as well as possible. As we touch on each area, think about how you can apply this research to your own life. Consider how you can do what you enjoy Make gradual changes. Start now, regardless of age. And I would add, forgive yourself for that day if you are exercising and you don't exercise, or forgive yourself for that day that you grabbed that donut and ate it, even though you're trying to avoid sugar. Whenever possible, think about how you can make changes that affect more than one area at once to maximize the benefit. Next slide, please. Let's explore the area of physical health and exercise. There's quite a bit of research in the area of how physical activity affects the brain. Many studies indicate that engaging in physical activity is associated with lower risk of cognitive decline. So many researchers say that if people had to choose one thing to do to improve their brain functioning, it should be exercise. Some evidence suggests that exercise might directly benefit brain cells by increasing blood and oxygen flow, and by reducing other dementia risk factors such as high blood pressure, diabetes, and high cholesterol. However, there is no single recipe for what may work best. Most researchers believe that exercise should be regular and more on the vigorous side, but other studies have shown benefits from mild activity such as walking. Now, in this first video, Woodley will describe developing a new habit. Could you please play the video?
It's surprising how you can easily build up habits of just taking 15 to 20 minutes out of your day to go down, hit the treadmill, and just do it. Just do it. Just get on it, put my headphones on, and just walk at a nice brisk pace for myself, build up a quick heartbeat, quick sweat, and it's amazing how quickly I can go from 15 minutes to 20 minutes. And then over time, 30 minutes, and over time, 40 minutes. Before you know it, you're up to 45 minutes of walking, and even at a higher incline and also at a higher pace. And again, it's all about incorporating habits in the choices that we make.
Next slide, please. The most important recommendation is to be as active as you can and to incorporate activity that you enjoy so you will continue to engage in it. If this is new for you, start out small. Walk around your neighborhood a few times a week, take the stairs more often, or park your car further away from your destination than usual. These little changes add up, and research shows that every 20 to 30 minutes of walking a few times a week can have health benefits. Participants in cardiovascular activity on a regular basis will increase the blood flow to their brain and their body, providing additional nourishment. Research has shown that for most people, any additional movement is a positive change that can have an impact on their overall health. The Centers for Disease Control and Prevention have developed recommended guidelines for physical activity. Those are: move safely to prevent injury, wear a helmet when biking to protect against head injury, and wear other protective gear when needed for activities. Ask friends to join you. This way you can make it a social activity and a benefit to your brain and a benefit to your body. And you get support from other people to continue the routine of your activity. Consider physical activities that may also be mentally or socially engaging, such as a dance class, exercise group, gardening group, golfing, playing tennis. Check with your doctor before beginning any new exercise program. Remember that it is never too late or too early to start. no matter when you start, your body and your brain will reap the benefits. Given our life within the pandemic period, I have personally had to be creative. Swimming was my exercise until COVID. I have given up swimming because of the environment of the gym. Therefore, I've had to develop other forms of exercise to stay physically active. May I have the next slide, please? Thank you. Studies have shown that smoking increases the risk of cognitive decline and may increase the risk of dementia. Additional benefits of stopping smoking include a lower risk of heart attack, of stroke, and of lung disease. Stopping smoking gives improved blood circulation, and it also avoids exposing others to secondhand smoke. Alcohol has many effects. Although a glass or two of red wine is commonly thought to have health benefits, you should not start drinking if you don't already do so. Also, excessive drinking of alcohol has some serious negative consequences, including slow or impaired communication among brain cells, fuzzy memory or drowsiness, long-term changes in balance, memory, emotion, coordination, and body temperature. Can be a big contributor to falls and fall-related injuries in elders. Can react negatively with medications, leading to potentially dangerous or even life-threatening consequences. If you're having a problem with alcohol or other drugs, please seek out the 12-step program and give it a try. It is an amazing, positive experience. Another protective factor is get enough sleep. 7 to 9 hours is the window that it's recommended for you to get to sleep. Inadequate sleep due to insomnia, sleep apnea, can cause problems with memory and thinking. Avoid injuries to your head. Head injuries and falls can contribute to the physical and cognitive difficulties. Be sure to wear a helmet when riding a bicycle or playing sports that could involve head injury. Studies have found that regular physical activity decreases stress, increases your ability to manage stress, and leads to a better overall mood. Monitor your level of stress. Take action to minimize it and seek professional assistance to address anxiety, depression, or other mental concerns. A statement that I like that builds into this is a simple statement of read, snack, and nap. Be sure that you've informed your doctor about all your medications you take and have them reviewed once a year. Next slide, please. Find a physician you trust and visit him or her on a regular basis. Follow up on our recommendations, the best thing you can do to maximize your health as you age. Growing evidence suggests that many factors increase the risk of heart disease and strokes, and may also increase the risk of dementia. These factors include high blood pressure, diabetes, obesity, and possibly high cholesterol. Although there is good research being done in these areas, more is needed. Here's what we know. Research has shown an increased risk of cognitive decline and dementia among individuals with diabetes. Although diabetes has not been shown to cause Alzheimer's disease, there is a relationship between those who have diabetes and those who get dementia. Studies have also found that midlife obesity may be associated with an increased risk of dementia. Research done on treatments to reduce midlife hypertension suggests that they may also reduce the risk of cognitive decline. Studies have shown mixed results for the relationship between high cholesterol levels and dementia. We do not know that a good cholesterol level is good for the heart. We do know that a good cholesterol level is good for the heart. And what's good for the heart may be good for the brain. The best way to combat these health concerns is to get your cardiovascular factors mentioned above tested regularly and work with your doctor to understand what the results mean for your overall health. Be aware of changes from the previous levels. Be aware of the changes from the previous levels to help determine what changes are needed to help you stay healthy. African Americans, Latinos, and other ethnic groups that tend to have higher rates of high blood pressure, diabetes, and cardiovascular problems need to work closely with their doctors to stay on top of these medical concerns. Next slide, please. The area that we need to explore is diet and nutrition. Again, we know that healthy fueling of the body benefits brain functioning. There is a connection between diet and cognitive functioning. There was an excellent presentation earlier regarding the DASH diet, the Mediterranean diet, and the MIND diet. May I ask you to play the video now?
Foods that have been shown to lead to healthy aging would be fruits and vegetables, and in particular green leafy vegetables and berries, as well as limited intake of high-fat food items that you get through high-fat dairy and cheese and red meats, and also healthy vegetable oils. So this would be, olive oil would be a good example, have been shown to reduce your risk of heart disease as well as dementia.
Next slide, please. Thank you. There are simple ways to adopt a healthy diet. Adding the vegetables. Eat fruit, nuts, beans, and whole grains. Fish, poultry, lean meats. Choose foods containing polyunsaturates and monounsaturated fats, and a diet low in saturated and trans fats. Stay away from foods, deep fried foods, and excessive sugar and salt. If you are shopping during this period of time of the pandemic, following these guidelines, you'll find you're going to be more on the edge of the grocery store rather than going up and down the aisles, because the healthy foods are along the edges of the grocery. Next slide, please. The healthy diet will help with the intake of vitamins. I'd like to talk a bit about dietary supplements or medical foods that are made for nutritional deficiencies and are to be used only under the supervision of a physician. Labels for medical foods or supplements cannot make drug claims or state that they alleviate symptoms of diseases, because they are not drugs as defined by the United States Food and Drug Administration, the FDA. Many are created with little or no regulation, may be potentially dangerous. Beware of false claims. Consumer Reports has found that the actual level of ingredients varies greatly within these types of supplements. The supplements are made up of chemicals that interact with other medications. This could be in a negative way. Emerging research to back up, even with emerging research to back up the claims, it can be difficult to understand what the research means for you. When getting information about a supplement or a vitamin, please check with a reputable source of information about the research that has been done. The best way to understand and address how to care for yourself best is to discuss with your physician. Work with a trusted doctor who understands your physical issues well. She or he can provide the best advice about medications, vitamins, and dietary supplements and how they interact with your body. It's important to discuss any changes in medications with your doctor. Next slide, please. Cognitive activity is a term used for keeping our minds active. Anything that uses your mind in a challenging way is a cognitive activity and can possibly have short and long-term benefits for your brain. As you use your mind in new and challenging ways, your brain actually begins to form and nourish new neural pathways for connections among the brain cells. The more pathways you have, the more nimble your brain is and better able to guard against the effects of injuries or diseases that can compromise brain functioning. Studies have been done in which some people engage in cognitive activity by playing games or reading material that is challenging for them. Those who keep their brains active in these ways could recall information that was recently learned or remember it later to a much greater degree than those who did not keep their minds stimulated through mental activity. However, we do not know all the reasons why staying cognitively engaged may be beneficial. More research is taking place today to further explore these questions. Research has shown that engaging in formal education, classroom-based learning administered by professionally trained teachers in any stage of life will keep your brain healthy and protect your brain from developing dementia. Some researchers believe that this may be due to the education creating a more robust network of communication pathways between the neurons in the brain. Others believe the difference has more to do with the educational levels being related to socioeconomic factors, which are correlated with risk in general and access to medical care. Those of you who are elders may find that your local community college will offer courses to you, both in person and remote, tuition free. Could you please also play the next video?
One of the most interesting factors is cognitive stimulating activities, which basically for us just means mental processing of information. It can be from a book, it can be from the radio, it can be a magazine, it can be from a lecture, it can actually be from watching TV. All of these things require processing information. And the old adage of, use it or lose it is actually something that turns out, at least from the observational data, to look like it's true. So numerous studies now have shown that being more engaged in cognitively stimulating activities is actually good for maintaining cognition. And it's true in late life, and it's true in early life. And so what we recommend is that you start early, and if you're already late, start now.
Next slide, please. Thank you. Participate in activities that are stimulating. Build furniture. Try a new cooking technique. Create art. Read books and articles that are challenging to you or inspire you. Find topics of interest that would lead to new learning or add to what you already know. Complete puzzles and play games that are challenging. This goes beyond jigsaw or crossword puzzles that you may find fairly easy to do. Here we are talking about solving a problem that has you stumped, or figuring out ways to approach a familiar task in an effective way. It requires that you think steps ahead and make plans for adapting to change that an opponent may make in a game like chess or bridge. Learn new skills or hobbies. Learn something new that interests you and that you find enjoyable. Engage in ongoing learning. Seek new opportunities for formal education. Join a club with a common interest. This is a double benefit. You will keep your mind active while engaging in social interaction. While brain training activities such as computer games that aim to improve memory and attention span are an exciting area of research, none of these activities are proven buffers against Alzheimer's disease. Alzheimer's, be cautious of commercially marketed brain games with big claims and promises. One of the best ways to stretch your mind and help your brain to be as resilient and healthy as possible is to consistently engage in activities that involve learning new things or solving problems. Be sure to choose activities you enjoy to increase the likelihood you will continue to engage in them over time. Next slide, please. The final area is the social area. Next slide, please. Volunteering is a great social activity. The least amount of research is in the area of social activity. There is some research that says connecting with others socially may benefit brain health and may actually delay the onset of dementia. Those who are engaged with other people also tend to have reduced rates of mortality and disability. Researchers aren't sure how or why, or if social networks may keep the brain resilient against Alzheimer's. Some scientists say the traits that enable people to build and maintain friendships act as a buffer against cognitive impairment. Regardless of the reason, we know people who don't do well in isolation. When people are feeling good about their social networks, they tend to make healthier choices in all of their areas of life. Obviously, you can see this presentation was written pre-pandemic. We have learned, and you're evident because you're attending a webinar, to have the social interactions through computers when we cannot do it elbow to elbow with the people we love and care about, or to meet new people. There are a variety of ways to connect and reap the benefits of social interaction. So important to choose the activities that are meaningful for you. That will provide the greatest connection for those around you and will help keep you engaged. Sometimes you can engage in an activity that combines an area of healthy aging, such as taking a walk with a friend, volunteering, or tutoring. Find a purpose in your life. Consider reaching out, contacting someone. Again, our internet is such a great ability for you to go and say, hey, I haven't talked to you in 10 years. I'd like to talk a little bit. Next slide, please. Each of these 4 components we've explored have potential benefits for physical and cognitive health. The recent research suggests, however, that combining activities in all 4 areas will have the greatest benefit in maintaining and improving brain health. Could you please play the last video?
Recently, at the Alzheimer's Association International Conference, there was a study reported of the results of a large clinical trial that was done in the Scandinavian countries. And in this trial, they took half the people in the trial and they adjusted their exercise level, their diet, their social engagement, and their mental stimulation. They developed programs for each one of those variables, changed all of those for the people that were in the test group, and the control group just lived as they had been. And what they found was that the test group had less conversion to mild cognitive impairment, which is a preliminary stage of Alzheimer's disease. To my mind, one of the things that this has done is it's changed the force of recommendation that we might make around the benefit of these interventions for prevention of Alzheimer's disease or for brain health. And the fact is that I think it's moved it from possibly exercise, diet adjustments, social engagement, mental stimulation are useful to probably. And that's a big change and makes it easier for people to make those kinds of adjustments for the benefit of their future health.
What I would like you to consider, begin today. It's never too late or too early to start living in a more healthy way. Start small and build. Forgive yourself. Pick one area to start with and expand from there. Take your changes step by step. Do what you enjoy and stick with it. The more you enjoy the activity you've chosen, the more likely it is that you will follow up on your plan. Do something that you can manage in the time you have available. Choose an activity that you can stick with over time. Make healthy choices, exercise, eat a nutritious diet, reduce stress as much as possible, make a plan, keep track of your progress, reward yourself for small changes and overall progress, get support from others, let other people know about the changes you are making, engage in activities that have a social component, celebrate the victories together, have fun, be sure your activities you choose are enjoyable, and reward yourself for your successes. Even an occasional sweet is a good reward for doing healthy living. I think I am out of time, so I'm going to turn this back over to Rosti and let him go forward from here. It's been a pleasure to spend time with you. Thank you.
Thank you so much, Mr. McNeely, for that excellent presentation. So we'd now like to actually conclude today's seminar. As always, we appreciate your support and participation of our event, and we hope to see you again next year. Be safe and take care.